I have Nate Schema, President and CEO of Good Samaritan Society, joining me now from the Congressional Briefing in Washington, D.C. Nate, thanks so much for your time.
Hey, Courtney, great to be here.
During this congressional briefing, Nate, you and other leaders of the Good Samaritan Society will share how the final rule that was released for an unfunded federal staffing mandate for long-term care providers threatens access to care for seniors in rural areas. What's the latest with this administration's staffing rule?
Yeah, it's a really important time in our industry's history. And one could argue that there is no greater existential threat than the one being posed by the current administration in this final staffing rule. There's a lot happening, and that's why there's record attendance here at our annual congressional briefing. There's over 700 providers across the country. We will have a visit happening in every single office up on the Hill tomorrow. And that shows just how important this time is. We are going to ensure that every single congressman and every single senator hears from providers on what this minimum staffing rule means to us. It's an absolute game changer. We know that access to care is threatened. We know, as a part of being a part of a large integrated healthcare system, that it's not just about those that we're privileged to serve. It's about the entire ecosystem. And so that's why it's so important that we're here today telling our story, telling our message, talking about what it means to have quality care close to home.
Yeah, Nate, what do you want our elected officials to know this week? What's your message to them?
First and foremost, we want them to hear directly from those that are providing the care. So we're also going to ensure that people understand that this final rule, it will threaten access to care. It will threaten the sheer existence of some of our rural locations. And so we want them to know without any shadow of a doubt what this means for us. We know at the Good Samaritan Society, we have over 1,500 open positions today. And through this final rule, we will have to hire an additional 100 RNs, an additional 400 team members to satisfy their new requirements. And it's an impossible task because the people simply aren't there. The pipeline is simply not there as it stands today. And yet we're committed to providing quality of care. And we believe we do that. And we have some other avenues by which we're able to deliver that care day in and day out.
Nate, thanks so much for the insight. On a lighter note here, what has been a positive or encouraging takeaway so far for you?
There is an energy here today. There's an energy throughout the building. There's an energy in the hallways. And you're seeing everybody galvanized around a common mission and a common goal. And certainly we're here to tell our stories and ensure that legislators and people up on the Hill understand why this means so much to our providers, why it means so much to our families, our residents, and the communities that we serve.
Nate, we are so grateful for all that you do and your colleagues there in Washington, D.C. Thank you so much for your time.
Hey, appreciate it, Courtney.